Eye surgery expert Dr. John Martin has discovered ways to minimize discomfort and bleeding through his specialized techniques with the latest laser technology. He is a pioneer when it comes to turning back 10 to 20 years of aging from the areas surrounding the windows of your soul.
A lot of people will start to develop puffiness at a fairly young age, and it can actually make you look quite a bit older, and you get a dark crease here from the shadowing of that fat. Now in the past, we used to take that fat out, but that would frequently make you look older because it would make you look hollow. So now what I do is from the inside of the eyelid, I take that fat and move it down into this area here, which is usually a little bit hollow. That way you get a nice smooth transition from the cheek into the eyelid, and it's much more rejuvenating than taking that fat out of there. When I do surgery, I use my laser to do my incisions. The advantage to this is that it cauterizes while I'm cutting so that you get less bleeding and less edema, so you usually will heal faster. That's not to say you won't get some bruising, but you should get less bruising than you would in a normal surgery. For most people, the eyelids are going to show the signs of aging first. So even in your 40s, a lot of people will start to notice either a drooping of the brow or a little extra skin or the puffiness in here. So in your 40s, that's a good time, if you have those issues, to do a surgery. In terms of the face, for most people it's sort of late 40s, early 50s. And the advantage to doing it at a younger age is that your skin is much better, you have a lot more elasticity, you're not going to be pulling quite as much, so that you tend to get a much more natural and really a beautiful rejuvenation from doing a surgery in your 40s or in your 50s.
Dr. Martin shared his advice on what procedures are available and when should one consider these enhancements.
Neck laxity and neck fat are a tough issue because even some people at a young age, for genetic reasons, may have that extra fat in their neck. If you're young, we have a laser that we use that will go in and melt that fat but tighten the skin at the same time. That way we can take out the fat and the skin will retract and you'll get a beautiful looking neckline again. As we get older, you usually will start to get some skin laxity, and then you're going to need both the liposuction with the laser down here and some sort of a tightening. So usually after like age 45 or 50, you need to do some sort of a neck lift at the same time that you do a liposuction for the neck.
We had a chance to visit his state-of-the-art facility where he conducts all his surgeries, and the private and exclusive location is by far an ideal place for celebrities, CEOs, and just about anyone who prefers the VIP treatment in healthcare.